Hello, today we are going to discuss medical jargons. Medical jargons, it is a type of language that when we use it in speaking with the patient, it will lead to ineffective communications and also will lead to ineffective management plan. Medical jargons, it is one of the common mistakes in the basis in exam. And the problem of medical jargons, it is a lesion or a disease in your language. The worst thing in the medical jargon, it is an infectious problem. It is spread between the candidate and no one can prevent it because the candidate will say to each other what's meaning by the words and no one can correct or stop these circles. So that we have to know what is meaning by medical jargons and try to avoid all things related to jargons. To be a good physician, you have to be a good teacher. And to be a good communicator, you have to be a good teacher. It is an art to break down all explanation in non-medical forms. And you have to be smart enough to avoid medical jargons and avoid this mistake in your exam and also in your daily activity. Let us start first to define each part of the body or symptoms or signs by non-medical word. We'll start with brain. In brain, we can call it headpiece. And seizures, it is for convulsion. Seizure or fits for convulsion. Stroke, it will be brain attack. Also, pin and needles in the hand, it's used for numbness. Shaking of your hand for tremors. So that I have to ask the patient, do you have any pain and needles of the hand? Not numbness or loss of sensation. Loss of sensation is a medical jargons, but pin and needles is non-medical jargons. If we'll go for the eye, we can ask the patient, do you have any change in your white area of the eye? For jaundice. For pallor, we have to ask the patient, do you feel your face become pale than before? Also for heart, shortness of breath, not dyspnea. So that dyspnea is a medical jargon, but shortness of breath is non-medical jargon. Awareness of heartbeat for palpitation. And chest pain for angina. Leg swelling, not lower limb edema. Lower limb edema is a jargon, so that we can use leg swelling. Expectoration or sputum, it is called the phlegm. For GIT, difficulty in swallowing for dysphagia. Indigestion for dyspepsia. So that if I am going to ask dyspepsia, I will tell the patient, do you feel indigestion? For dysphagia, I will ask the patient, do you feel difficult in swallowing? For vomiting, do you feel sick? For nausea, do you become sick? For diarrhea, we have to ask, do you have loose motion or hard stool? Or do you have any problem in your back passage? For urination, what's about your water work? Water work for urination. Joint pain, for locomotor system, do you have joint pain or back pain and stiffness? Loss of consciousness, blackout. Syncope, blackout. Osteoporosis, it is called brittle bone disease. Tinnitus, it will be ringing in the ear. Pruritus, it is itching. Menstrual period, it is period. Skin rash, you have any skin rash or physical, we call it blister. Physicals, multiple physicals, we call it blisters. Any rising in any fever, we called it increased in your body temperature. A swelling in your lower limb, as I said, it is called edema. Abdominal discomfort and distension, it is called wind. If the patient has history of cancer, we called it gross. For trachea, we called it windpipe. For esophagus, we called it food pipe. Vertebral column, backbone. Stomach, it's called belly. Genitalia, we can call it private parts or down below area. Brain, it is a headpiece. This is the medical words. We can express him in non-medical expression to give the patient information in the right way. Bad odor, we called it sour smelling. Axilla, we called it armpit. Endoscopy, we called it camera test. Ultrasound or CT scan, we called it will do a scan or an image for X-rays or MRI or CT. This is example of the medical words and how can express it in non-medical words. One of our colleagues asked me how to take a history for psychiatric patients. I will nominate some questions to assess the psychiatric problems for the patient. Sir, could you tell me how has your mood been lately? Do you have any change in your mood? Very important to evaluate the mood of the patient. First question, how is your mood? Have you felt like crying? Have you felt anxious or worried? Are you finding it's difficult to cope with the life at the time being? Do you have any difficulty falling asleep? Do you wake earlier than usual? What about your appetite? Are you able to enjoy things you normally do? Have you lost interest in things around you? How do you see your future? Do you ever thinking about wanting to die or wishing you were dead? This is an example of questions to express about psychiatric problem. We can repeat it again. Open question by, could you tell me how is your mood now? If he answered, I feel depressed, we can go by another question, have you felt anxious or worried? If he told you yes, you can go for another questions to evaluate his mood. If his patient has mild depression or moderate or severe depression, by asking him, do you wake up earlier than usual? Do you have any difficulty falling asleep? Then if go for the next two questions, have you lost interest in things around you? Are you able to enjoy the things you normally do? Most important two questions to, if the patient answer yes, it will be moderate depression. Again, we can repeat it. Have you lost interest in things around you? Are you able to enjoy the things you normally do? Then for the further two questions, how do you see your future? Do you ever thinking about wanting to die or wishing you were dead? This is to evaluate the psychiatric problems in the patient so that we can also evaluate by harming the patient to himself. Do you ever have any thoughts about harming yourself? So, this is the psychiatric history, one of the difficult history to taking it from the patient in the real exam. I repeated it twice and I will repeat it again by 6 questions. First, open question, how is your mood? Have you felt anxious or depressed? Do you have any difficulty in falling asleep? How have you been sleeping? Or do you wake up earlier than usual? Have you lost interest in things around you? Are you able to enjoy the things you normally do? Then I ask about the future. How do you see your future? Do you ever think about wanting to die? Or do you ever have any thoughts about harming yourself? This is an example of the psychiatric history, and this is an example of the medical jargons. In autoimmune disease, we have to define it by the same way that I am going to do. Any autoimmune disease, like celiac disease, like systemic lupus, rheumatoid arthritis, we can define it by this way. This disease is an autoimmune disease. Do you know what's the meaning by autoimmune disease? The immune system makes white blood cells. It is type of the cells inside our blood, and also make something called antibodies. These antibodies work to protect our body from foreign objects such as bacteria, viruses, and other germs. In autoimmune disease, the immune system mistakes part or parts of the body and dealing it as a foreign material so that it will attack immune system will attack our body and it will be reduced. A disease is called autoimmune disease. This is a definition of autoimmune disease. By the way, if you have any bacteria, you can call it germ. If we are going to inform the patient you have tuberculosis, I can say first for him, the results of investigation released and showed that you have germs in your chest. And this germs, it's called tuberculosis. For cancer, we can say it's a growth. And there's a difference between genetic diseases and autoimmune diseases. Not all autoimmune diseases runs in family, but genetic diseases, it could be runs in family. Hereditary disease, it is run in family. So that, in a summary, medical jargon is very important to avoid it in the exam. In real life, medical jargons could lead to ineffective communication and unsatisfaction of the patient, and also could lead to the patient understanding the information in a wrong way. So that we have to work to avoid medical jargons, and we have to know how to express the medical terms but by non-medical terms. I hope this a brief about medical jargons could help our candidate and let them to understand what is meaning by jargons and to avoid it in the real life and also in the exam. And thank you. See you soon.